Richard patiently wildcard. You have a different perspective. You head an organization called Carers WA, and then as a concept, you work across multiple sectors. And NDIS is part of one of the sectors you're working in. Before you talk about what are the trials and tribulations of carers, give us the context in terms of number of carers statewide, and give us some numbers and give us the context on that front before you talk about.
Sure. Thanks, Deb. 320,000. That's a very large number. That's the number of carers in WA. 40,000 of those are young carers aged between the ages of 8 and 24, looking after their siblings and in most cases, looking after their parents. $6.6 billion worth of support that carers provide unpaid across Western Australia. In the Australian context, it's $77 billion worth of care and 2.85 million carers. Now, I'm going to put that into context. 645,000 registered health professionals in Australia, 2.85 million unpaid, unregistered carers. We go home at the end of the day, we've done our 30 hours, 40 hours, 50 hours, and we're absolutely exhausted. Half of carers across the country do 109 hours of care per week. There's only 140 odd hours in a week. That's the context of caring in Australia and in Western Australia. We talk about NDIS being the only lifeboat or the only single door entry. What happens when that door is closed or when that lifeboat is full? Carers and family members pick that up. And I think there is a lot of work to be done in the NDIS space that recognises informal care. They talk about informal care a lot, but what does that mean? It means the brothers, the sisters, the mothers and the fathers of the person with a disability receiving the supports. They pick up that extra work, and yet there's no recognition of the work that they do. So let's take a holistic approach of actually supporting the whole family and the person around getting the support. That's how we build an inclusive model. We don't look at it in isolation. We don't look at health, disability, ageing in isolation or in silos. We look at it as a cross-sector issue, and carers underpin that. And you talked about NDIS being the cherry. Care is the cake, the plate that the cake and the cherry sits on. Let's fix that. Let's get some supports in carers. Let's get some recognition building, and we'll stop these admissions to hospital or the readmissions or the inappropriate admissions or the increasing amount of social admissions to hospitals. So let's fix that, because it's a very cheap fix and it's a very quick fix. And then we can start building on underpinning the NDIS with the supports that's required.
Thank you. You are a wild card.